Welcome to this week's episode of Reconnection. As always, I want to remind you not to take action based on the information shared in this podcast without consulting your healthcare provider. Also, while we may touch on certain advocacy topics that relate to to politics, please keep political commentary out of the discussion to ensure that our focus remains on supporting the rare disease community. In recognition of Homocystinuria Awareness Month, we are featuring stories from individuals with different forms of homocystinuria. Today's guest is Anna, the mother of 12-year-old Juana from Uruguay, who is the only known patient in the country diagnosed with classical homocystinuria. Juana's journey began as a healthy baby, but by the age of 3, her vision issues became evident. After at 5, an ophthalmologist noticed movement in her lenses, initially suspecting Marfan syndrome. After years of uncertainty and internet research, Anna advocated for homocystinuria testing, which was finally confirmed after persistent efforts. Despite the diagnosis, Juana faced additional challenges. She also, such as lack of available treatments in Uruguay, through persistence and support from international organizations like HCU Network America. Juana has access to medical foods and formula she needs. Although her late diagnosis has resulted in limitations, Juana has shown remarkable strength and responsibility in managing her condition. Even attending a life-changing HCU conference in the United States. Juana's resilience and determination are inspiring. And today, Anna will share more about the challenges they face in the community they found and how they work towards a brighter future. Stay tuned for this heartfelt conversation. Anna, can you take us through the process of how Juana was diagnosed with classical homocystinuria, especially after initially being suspected of having Marfan syndrome?
Well, when I was almost 5, when we were first told by her ophthalmologist that she could possibly have Marfan syndrome, she saw first a cardiologist who said everything looked fine, and then she saw another doctor. I was never told what kind of doctor it was. It was referred as a specialist. And it was a doctor who said that she did not fit the criteria to be considered like a possible case of Marfan syndrome. In Uruguay, we have there is a special clinic where they treat all rare disease. So it's a very small country. So this clinic is where every patient with a rare disease has to go. And the only way to get in that clinic is with a referral, because there is a strong possibility of the patient having a rare disease. And of course, you have to say which one. So by that point, after that doctor saw her and said that she did not fit the criteria to be considered a Marfan syndrome patient. We're just told that what was going on with her eyes was just like bad luck. It gets pretty confusing, like the timeline from those years, because it was really hard. It was a painful time, and then we got like we started seeing a lot of doctors. It was consult after consult. We were told many different things. Because there were other things, like it wasn't just her eyes. She also had problems with her feet, with her legs. She had like behavioral issues. There were like a lot of different issues, and like none of them were really connected. And we had another appointment maybe a year after with her ophthalmologist, when he told me like he was confused, because he didn't understand how it was possible that the Marfan syndrome test was negative. And when I told him that she had not actually been tested for anything, he said, no, there's something here, she needs to be tested. So then I went back to her pediatrician, got a referral for the clinic, but it took a year to get in. We didn't end up going to that section of the clinic, because we got her diagnosis first. Her feet, it was like in 3 months, her feet started changing. They became really arched, and I took her to another doctor again, and look, I have a picture here. So these were Juana's feet right there. So she didn't used to have them like that. So that was what I found strange. I took her to the doctor. She says, yes, she has arched feet. Another bunch of doctors, and I said enough. By that time, I said enough. So I started searching. I started with a Marfan syndrome page. It took me to a section that it said ectopia lentis, and then there was a list of 10 conditions who could present what Juana had in her eyes, in her lenses. She didn't have her lenses weren't dislocated, but the shape wasn't correct. Like the shape wasn't right in her lenses, and they had movement. So I started reading one by one the 10 conditions until I reached Homocystinuria, and I thought that it was the one that made sense. Of course, I freaked out because it said that it needed treatment and many other things, and then I had to go back to the doctors and tell them, well, I think she has this, and that was hard because the doctor thought I was absolutely crazy. I came like to the office and said, I think my daughter has this, and they didn't even know what it was. But she did. We ended up getting to, now she goes to that clinic where they treat rare disease and metabolic errors of metabolism, but
what were some of the early signs you noticed, and what pushed you to advocate for additional testing?
Yeah, well, when I wasn't healthy before her diagnosis, I felt something was off, but sometimes I just thought it's like my mind playing tricks. She didn't sleep much when she was a baby. She vomited like baby formula. Whenever she, like, all the different types she tried. Then as a toddler, she was a really picky eater, and she would tell everyone that she was 3, and she would tell everyone she was a vegetarian because she absolutely hated eating meat. And she also had behavioral issues which caused many problems at school since she started kindergarten, pre-K, not even kindergarten. But it was like she was the baby of the family, so everyone thought she was just a tad spoiled, you know. Then when she was 2.5, and we started noticing that she didn't see well. She would come, like, I have some pictures here. She was like playing. She would look at things really close, and then, like, here she's writing, and she's going like really near the paper, and I asked her an appointment. Any appointment with a specialist usually takes like 3 months. By the time that she had the appointment, there was like no doubt in my mind she needed glasses, but her prescription was a shock. Her first prescription, this was Juana with her first glasses, it was like a -11, so she couldn't see, like, before the glasses she couldn't see, and more or less it was that. She was in hospital then for almost a month, around 5, before her ophthalmologist found the problem with her eyes, because she had some kind of bone infection. Here she's in the hospital. So she wasn't healthy. It seemed like there was something going on all the time.
How did you manage to secure the necessary medical foods and formula for Juana, given that they aren't available in Uruguay?
Well, after we started going to a clinic, and that it was like, we were sure she had homocystinuria, and they tried B12 to see if she was B6 responsive or not. It took around 6 months to establish her treatment. She wasn't put on formula right away. I actually found out about the existence of formula thanks to the HCU Network America support groups on Facebook. So in Uruguay, the government provides everything that has to do with testing, formula, and low protein flour for metabolic patients. Once that it was established that she needed formula, the government pays for it. They bring it especially for Juana from other country, and it has they covered the cost. As far as medical food, the only medical food available here is low protein flour, which we also get we get like a monthly package with the formula and the low protein flour. But well, we mostly make bread, baked goods, some kinds of pasta. But she mostly eats those things, and fruits, vegetables, vegan and gluten-free products. We don't have many many medical foods here. Sometimes we buy them from Argentina, but it's kind of difficult to bring them. So we don't really have access to medical foods apart from the low protein flour. There was a law recently passed. There's a group of metabolic patients here, and there's a law that says that apart from the formula and the flour, the government has to also provide other low protein foods like pasta and rice and those kind of things, but it hasn't happened yet.
What challenges have you faced in maintaining a consistent treatment plan for Juana?
In maintaining a consistent treatment plan for Juana, we've been able to maintain a pretty consistent treatment plan. It was hard. It was really hard getting that treatment plan, and we still have some difficulties when there are adjustments that need to be made. I think that there are not many metabolic patients here, so maybe maybe we don't have all the resources that we need. There was a lot of learning on everyone's part. It had a huge impact on us as a family, on the people around us. Juana has been amazing at it. She really respects her treatment. She understands what has to be done, and so far we have not had any issues with her not adhering to the treatment or trying to do things she should, or eat things she shouldn't, or refusing to take her formula. But still, it hasn't been very easy. Mm-hmm.
So, how has homocystinuria affected Juana's daily life? Yeah, in Uruguay. How has homocystinuria affected Juana's daily life in terms of school, social interactions, and physical activities?
Yeah, it has without doubt had a huge impact on her daily life. We already started with her because she was because she had such a high myopia. When she was 5, she started wearing contact lenses because she could not see well with just the regular frame glasses. So that, like from the very beginning, before she was diagnosed with homocystinuria, the consequences of having it had a great impact in her. Her vision has never been very good. She struggles a lot with that at school. Sometimes she can't. There are certain things she just can't see, and she does need a lot of help with schoolwork because of her eyes, the problem with her lenses. Her doctor doesn't want her to kind of need like an emergency surgery, so she's not allowed to do sports. Like she can't do anything that would mean any kind of impact. So she hasn't been going to gym classes for her entire primary school years. She tried last year to just go to the gym class and do whatever she could do, and she would just spend the entire class sitting there reading, and she asked me not to take her anymore. She was just sitting there, the young kids were playing. As far as social interactions, we try for food not to be a problem. We try to be prepared. Unexpected things happen, and I think that people just forget or they don't know what to get for her. Even though everyone tries to accommodate for her dietary restrictions, and I always try to have something for her for special occasions. I think that's one of the things that has a bigger impact on patients. She really puts on a brave face, but I do think she sometimes feels ostracized because she's just left out of a lot of occasions and situations because of her dietary restrictions.
What strategies have you developed in order to navigate Juana's dietary restrictions, especially in social settings like restaurants and parties?
So as I told you, we get low protein flour, and for many years that was the only low protein food we had access to. So there's a lot of cooking involved. I want to show you some of my recipes. So these are empanadas, low protein, then gnocchis as well. So this is a hamburger. This is from some low protein products we got in Argentina. So there's a lot of cooking involved. I spent, I don't know, my whole weekend cooking. This is as well. This is like pasta, raviolis. So there is a lot of cooking there. I'm also always on the lookout for any vegan or gluten-free products that would work for her restrictions. I think that we don't have like everything. I haven't got like the handle on everything yet. Whenever we go to restaurants, she just orders fries. She's not big on salad yet. We're trying. Whenever she has a party, she takes food with her. Sometimes they, like the hosts try to have something that she can have. But yeah, I think it's mostly it involves a lot of cooking and trying and new recipes and changing things a bit from regular recipes to try to make them low protein.
Since homocystinuria is not widely known in Uruguay, how have you managed to educate medical professionals about the condition? Has this been met with resistance? And if so, how have you overcome it?
That's been tough. I like to think that I try to educate medical professions about homocystinuria. As far as resistant, new doctors, like whenever we see a doctor we haven't seen before, they are really open to hear me out. I think that when they are facing like a rare condition, they know they need to listen to parents. They know we have more information that they do. So I've never met resistance there, but they are. I think they're kind of scared of giving her any kind of medication. We've had that issue a few times. They are not sure if she could take something or not, or they don't want to take risks, which I understand. We try to avoid the emergency room as much as we can. Like if she has like a cold, or we try to handle it at home, a cold, a stomach bug, whatever. She hasn't gotten seriously sick so far, which I'm really grateful for. I do think that in the case that she needed urgent medical attention or a surgery, like in the event of an emergency, I don't think that here in my city we could get the attention that she needs. I'm pretty sure that we would have to get sent to Montevideo, to the capital city, and I'm guessing that her metabolic team would have to be called. I don't know if there's any hospital here that is prepared for someone with homocystinuria going through a medical emergency.
What improvements would you like to see in Uruguay's healthcare system for rare diseases like HCU?
I think that it's a necessity and to have HCU included in newborn screening. I think that's the most important thing. Juana is a living testament that HCU is not easily diagnosed. Patients can thrive with treatment. She's been doing great. And even after spending 7 years of her life without treatment, she's thriving now, and I think that it goes to show that HCU can be manageable, and no one should have to go through the journey that we went through. It was wild. No child deserves this. I think that having HCU included in newborn screening is it's a must.
Does Uruguay have your newborn screening?
Have newborn screening? Yes, we do have. They test as far as metabolic disease, like the ones that require low protein, there's PKU, and I'm not sure if GA1, glutaric acidinemia, I think it's included as well.
How has connecting with HCU Network America and attending the conference in the U.S. impacted both you and Juana?
Connecting with HCU Network America saved my daughter's life. I wouldn't have been able to get her on the right treatment if it wasn't for them. Those Zoom meetings at the first year of the pandemic, they were my absolute lifesaver. We were struggling so much with everything. Her diagnosis, the medical appointments, the low protein diet, talking to people who understood meant everything. And attending the conference made us more confident about the future. Juana loved meeting other patients. She was actually relieved that there were others that they were okay. She hadn't seen anyone with her condition up to that point, so it made a huge difference to me, connecting with families, seeing older patients living their best life. It was amazing. I think that up to that moment, I had felt so afraid, so unsure of what the future would look like for her.
Can you share any insights into Juana's experience at the conference, particularly how it changed her perspective on living with HCU?
One of the first, so she had never seen, like she had seen some patients on the meetings. But she hadn't met like other people with HCU. She had heard many things during appointments. Everything was very unknown during the first appointments. So I think she heard many things that she shouldn't have. When we first got back from the conference, we were home and her uncle, my brother, was here, and she started telling him about her new friend Samantha that she met at the conference, and she told him she has HCU too, and she said and she's okay, like she's healthy. And up to that point, I hadn't realized what an impact it was for Juana, or how she felt. I think she felt that she was really sick, and seeing that there were other people with HCU and they were okay, like they were healthy. For her, it was very important. It gave her a bit of confidence as well to start asking questions. Another thing was she started asking me what it meant to turn 30 when you had HCU, because she had heard the number 30 as life expectancy at some appointments, not without treatment. I mean, she had heard it. The life expectancy was 30 without treatment. And she started telling me that, but they're like looking at pictures and stuff. She started telling me, but these people had HCU as well, and I said, yes, they do. They have HCU. And she was like, but their hair is gray, so aren't they older than 30? And I said, yes, they're older. And she was like, so then she says, people with HCU can be older than 30. And I said, yes, of course they can. I said, as long as you follow the treatment, you're going to be very old. You're going to grow very old. And she was like kind of excited about that. She said something like the formula gave her superpowers because it helped her live longer. She was young. She was 8 at the time, but it had 10 at the time, but it had a big impact on her.
How do you envision Juana's future as she continues to manage HCU? What hopes do you have for her regarding her, potential treatments and clinical trials?
I still feel really anxious about the future. I worry how she will be able to afford being on a low-protein diet, or the consequences of her late diagnosis, if they will cause her more problems in the future. I have a hard time envisioning the future. I just hope it's a good one. I hope there's a better treatment on the horizon, a treatment with guarantees, something that is not like an economical and emotional burden for patients and their families. I hope that those things happen in the near future, so they can have better possibilities, a better chance.
What advice would you give to other parents going through a similar journey, especially in countries with limited access to resources?
So here in Uruguay, I participated in some local television programs. So before Juana's day, before reading about it online and confirming that Juana had homocystinuria, I have of course never heard about it before. So we try for HCU to be part of everyone's vocabulary. That's why I participated in some local television programs. Juana does an activity at school for Awareness Month every year. We just try to tell everyone who's willing to hear about HCU and what impact it has on people's life and what symptoms to look up. So just telling our story and how we came to find Juana's diagnosis and try to educate people on HCU. We've also joined a patient group where there are some amazing metabolic families. And this year, we actually got the chance to participate in the Latin American Inborn Errors of Metabolism Conference. We got ourselves a table to present our material, and we're going to have the chance to meet the specialists and doctors from Latin America who have dedicated their lives and careers to metabolic disease and inborn errors of metabolism. So we're gonna do that this month in October, actually.
What steps have you taken to raise awareness about HCU in Uruguay, and what more do you think needs to be done to ensure patients get the help they need?
Well, I would tell them to learn, to never stop advocating for their children, to trust that they are the ones who know their child best. Education and knowledge are the best tools we have to defend our children's rights and to make sure that they get the best medical attention. I think it's very important for patients and family to learn about their condition, to try to get all the information they can, to know what things mean, why certain tests are done, how to manage their condition. I think that's one of the most important things that families need to know when they are dealing with a metabolic condition.
Do you have any advice for families advocating for rare diseases awareness and resources, both locally and internationally?
I think that no matter how small the impact we make it still counts. Every person that learns about rare disease could potentially make a difference. So it's important to share information as much as we can. I think that teamwork is necessary in these kinds of situations. There are not many of us, and we need to work together. So we need to stick together to be seen and for our voices to be heard. So I think those are the most important things to advocate for rare disease, to try to do as much as you can, no matter how little it is, and to come together and to form a community as well.
Thank you so much for joining us today on this episode of Rare Connection. If you or someone you know is struggling with thoughts of suicide, please seek help immediately. You can reach the Suicide in Crisis Lifeline at 988 or call the National Suicide Prevention Lifeline at 1-800-273-TALK. or 1-800-273-8255. Your life matters, and there is support available. Before we wrap up, I'd like to invite you to subscribe to my YouTube channel, Rare Chef, where I share cooking videos for those with dietary restrictions, and of course, to my podcast, Rare Connection. You can also visit our website at rareconnection.org for more information about upcoming episodes and resources. We also have a Facebook page and group where you can engage in our community, where you can engage with our community, share stories, and connect with others with similar challenges. If you'd like to be connected via email or with someone from the community, feel free to send me a private message via Facebook at Joanna Ball, or you can private text me, or you can privately text through the link in the show notes, as we're still working on fixing the website link. You can also leave a comment below with this video, if you're watching on YouTube. Thanks again for tuning in, and I look forward to connecting with you next time on Rare Connection. Stay strong, and remember, you are not alone in this journey.